welcome back to another Riding with Angels video. In today's video, we're talking about horse dentistry and why it's important. It's important to have our horses' teeth done at least once a year. It's extended many of our horses' lives and even saved some of their lives. At Midwest Veterinary Dental Services, it's more than just floating their teeth. They do things like inspecting the entire mouth, pulling teeth if necessary, fillings, and so much more. It's especially important for the senior horses here that need more extensive care.
Hi, my name is Dr. Molly Rice. I am a veterinarian that works for Midwest Veterinary Dental Services. I've been a board-certified equine dentist for several years now. I started out in general practice like a lot of veterinarians do, and actually when I graduated from vet school 20 years ago, the equine dental specialty didn't even exist. So I was in general practice basically for 6 years, and then I started into this dental specialty practice, and then I became specialized when the dental specialty became in existence. So all I do is dentistry, and equine dentistry specifically. We have veterinarians at our hospital that also see small animal patients and exotic patients as well. But I really love taking care of horse teeth. I do a mixture of routine dentistry and advanced dentistry. So I do routine dentistry out in the road, so that's floating teeth, doing periodontal treatments, workups and things like that. And then most of our surgeries we do in our hospital, which is in Elkhorn. Tiara, she's a 7-year-old Mustang mare. I think we floated her teeth about a year ago, so she's just due for her routine dental. When we do our dental exam, we do a 5-component exam. So we start with the external exam, so we look at the external face, at the musculature. The chewing muscles are primarily the masseter muscles here, so we look for symmetry or any lumps or bumps or swellings along the jaw. So I like to palpate the lower jaw or the lower mandibles without the halter on, so I can compare the right to the left, and she's very symmetrical. The next thing I'll do is I'll take my fingers in and just run my fingers along her bars, so the upper bars and then the lower bars, and that'll give me an idea of how the bony structures of her mouth is where the bit sits. So sometimes we'll find an unerupted wolf tooth, or sometimes even an erupted wolf tooth, and some horses will get remodeling along those lower bars in response to bit pressure. So that just gives me information. You know, if we find that, we like to ask the owners how they ride in the bridle, etc., to find out if it might be potentially a problem. So the next thing we'll look at is we'll just peel her lips up and look at her occlusion. So you can see she has a pretty nice bite. Her teeth line up well. I will say if you raise their head, you can give every horse an overbite, right? You see how she has kind of an overbite? So when you evaluate their occlusion, you want to kind of do it at a neutral head position, kind of with their head level with the withers. So then I'll take a look at those incisors and just make sure that they all look healthy. Some horses will get little hooks on these corners. She doesn't have those quite yet. So she looks pretty healthy there. So now we're ready to put the speculum on. This is a dental speculum that will help us open the mouth safely. So we just slide this up over the ears, and then we'll slide the bite plates into her incisors here where they rest on these padded plates here. So the next thing we'll do is just open a little bit. Mike is just going to check to see that her tongue isn't trapped underneath the bite plate, and then we're just going to open. Yep, so you know, she's got some sharp enamel points and abrasions in the cheek, which is pretty typical. I can see on this side of her mouth, she's got a tooth here that I'll want to look at a little more carefully with a mirror. It looks like it might be rotated, or something might be a little abnormal with that tooth. So the next thing we'll do is look with a mirror. So the components we've looked at so far are the external, the occlusion, which includes the sharp points and how her teeth align, and then the oral soft tissues. So she's got some minor abrasions, and then the next two components we're going to look at are the endodontic and the periodontal. So we just go tooth to tooth and we look at each individual tooth for any cavities, any gum disease, any tooth fractures. Everything looks pretty good in here so far. So the 209 here is a little bit dysplastic, or it doesn't have quite a normal surface anatomy. And that's probably just a minor developmental defect in that tooth. I believe we've noted that before. But overall, she's got a pretty healthy mouth for a young horse. So the next thing we'll do is we'll float her teeth to remove the sharp points. So we use a water-cooled instrument. This is called a flexi float, and it has a diamond carbide burr here that spins. And we basically use that spinning burr to grind the points off. And the instrument that we use has water cooling. You can see the water squirting out there. And that basically prevents any thermal damage to the tooth, which we think is pretty important. So this is a different float that we use. It's called a finishing float. It has an apple core shaped burr on it, and it just goes into the back of the mouth where it's a little tighter back there and gets those points off. So the last thing I do is always another mirror exam. So I always look at the teeth with the mirror again in case there's something I missed the first time through. So then we take inspecting them off. We'll look at the incisors one more time to see if any adjustments need to be made there. And we'll check her lateral excursion again. And she slides really nicely both directions. I like to check that with her head off the stand as well. You can see she's got nice grinding motion. So that's it.